Chief Clinical Officer for Hartford Healthcare. We'll start with some of the details regarding the number of patients we're carrying in Hartford Healthcare today, and then after that I have two guests who are going to talk about other important aspects of our care process in Hartford Healthcare. So let's start with Bacchus Hospital. We have two patients who are positive at the moment. Charlotte Hungerford has 4 patients, and if you remember, Charlotte Hungerford had at one time more than 22 patients. For the size of the hospital, I think there was a lot of patients that we're caring for right now. The 4 is a very promising number. Hartford Hospital has 32 patients. Mid-State Medical Center has 6 patients. St. Vincent Medical Center has 28 patients. Hospital Center Connecticut has 11 patients, and Wyndham Hospital has 1 patient. Total 84 patients in our acute facility at the moment. Our behavioral health network is managing 2, and community network is managing 146 patients in different areas, such as home care and SNF areas. Just as a reminder, a total number of patients who are on ventilator at the moment for COVID-related is 14 across the system. This is a rather small number, which is a positive sign. As I indicated yesterday, we're seeing a fair amount of patients who are managed on the floors and the high flow oxygen, but not requiring intubation, which is a positive thing at this time. This is the time for testing. I think we've been ramping up. We've been working hard to make sure our testing capabilities are optimized, especially for the communities who have difficult to access the testing, such as some of the inner city areas, some of the areas where there is a disparity for the healthcare access, and we're seeing that in a variety of forums right now, but that's where we have been focused on. Yesterday, really, we're a proud moment for Hartford Healthcare and the city of Hartford as well. With the partnership with Artist Collective, we had mobile testing station. That was the 50th mobile testing site we had, and we tested 311 individuals over there. That's kind of a community work. That's access to our partnership of healthcare system and state, and then the city can provide, and that's where we need to focus on. It remains critical during these times. Testing coupled with isolation, coupled with all the physical distancing measures, hygiene, this is what is going to get us through this COVID crisis right now, and I think we are poised to do that very well. Today, Hartford Healthcare will be at the Southbury Training School in Southbury, and this week we will be testing on Wednesday in Southington Care Center, on Thursday in Jerome Home, and next Tuesday, Phillips Health Center. Next Wednesday, Open Heart, and next Thursday will be on the Osborne. We'll be testing all these sites as our commitment to the community. And mind you, as Governor's order from yesterday regarding the SNF and assisted living testing, we'll wait for further more details from DPH, but I'm happy to talk about that, how Hartford Healthcare plans to tackle that as we go forward. With that, we have 2 guests. I'm going to introduce the first one, Dr. Amanda Zaleski. She's a clinical researcher and CPR instructor in the Department of Preventive Cardiology. She'll be talking about some of the research work we've been doing in a cardiology area at this time. Dr. Amanda Zaleski, thank you.
Thank you, Dr. Kumar, and good morning, everyone. My name is Dr. Amanda Zaleski, and I'm a clinical researcher in the Department of Preventive Cardiology here at Hartford Hospital. Today, I want to share with you the results of our publication recently published in the American Journal of Cardiology. This study does represent the first publication to come out of the HHC system, the first of what we know will be many related to COVID. We were interested in examining trends in acute cardiovascular emergencies or emergent heart attacks during the COVID pandemic. And what we found is that there was a 38% reduction in the amount of patients who are presenting to Hartford Hospital with these acute cardiovascular emergencies. Now, we are not the first hospital to be seeing this right now. This has certainly been reported on anecdotally in the world in the United States. We are the second to confirm these findings in peer-reviewed literature. Nevertheless, it's very concerning and worrisome because normal humanitarian emergencies, historically like 9/11, Hurricane Sandy, Hurricane Katrina, have led to an uptick of cardiovascular events. Coupled with the fact that we've known very early on that COVID seems to affect the heart and there's a strong interaction there, really does beg the question, where have all of these missing heart patients gone? Now, of course, we know that a percentage of these patients have unfortunately likely succumbed to COVID, right? So that would require knowing how many patients for March and April were going to have heart attacks and unfortunately contracted COVID instead. We don't have that crystal ball. Nevertheless, those patients aside, we do have strong data to suggest that a large majority of those patients are actually at home delaying, prolonging care. And this is not a good thing because we know that for acute cardiovascular events, the longer we go without intervention, the worse our outcomes. In fact, I can anecdotally share we're already beginning to see this trend for May. Patients are starting to come back in, however, they are looking much more worse and because of how long they've delayed their care. So all of this to say, our take-home messages are this. There are three. One is please, become aware of the signs and symptoms of a heart attack. These are crushing pain, tightness, squeezing, perhaps radiating to the jaw, neck, or back. For women, we know it can be a little bit different. This can present as sometimes upper GI distress, back pain, nausea, certainly fatigue upon exertion that may come or go. Please be aware of those symptoms. It's very important that everybody knows these symptoms because we know that the single biggest predictor of pre-hospital behavior when I'm deciding if I'm going to seek out care or not is what my friends and family tell me, right? And so even if I'm not personally at risk for a heart attack, I'm going to want to know those symptoms. Two is please do not delay care if you're having any of these symptoms. We are here, we are open, we've always been open. I can assure you that my colleagues in the emergency department, our nationally accredited chest pain center, and cardiology have done a great deal of preparation in order to provide the same level of care without compromising our safety. We're here for you, and we want to see you if you think you need help. Lastly, is that it's CPR Awareness Week, starting yesterday, beginning through the end of this week. And so we really do encourage everyone to please take the time to become familiar with what to do if you or someone you love is experiencing chest pain or they think they might be having a heart attack. To do this, we ask you just to go to hhchealth.org, and in the upper right-hand corner of the search bar, if you type in "Be a Lifesaver," there is a 35-second video that we really encourage everyone to watch today. With that, I want to just acknowledge my co-authors, Dr. Beth Taylor, Dr. Raymond McKay, and Dr. Paul Thompson. This really was a rapid, collaborative effort. I can share that we are going to continue to watch these trends to inform both hospital preparedness and educational outreach. With that, I'm going to hand the mic over to my colleague, Dr. Alan Solinsky of the Hartford Hospital Eye Surgery Center. Thank you.
That was a fantastic talk. I'm Dr. Alan Solinsky in private practice in West Hartford, Connecticut, and a member of the management team over at the Hartford Hospital Eye Surgery Center in Newington, as well as the Rocky Hill Surgery Center in Rocky Hill, where we do cataract surgery as well. Why are we having an ophthalmologist talk to you after 10 weeks of COVID? Well, several reasons. One, an ophthalmologist was the first person to sound the alarm about COVID. Number two, COVID really can affect the eye. Number three, ophthalmology, the profession of ophthalmology, had the largest decrease in volume of all the specialties because all of our patients are older. And cataract surgery has decreased significantly. Nearly 500,000 patients have not had cataract surgery in the last 3 months in the United States. It's now very safe to have cataract surgery, and better to do it now with the summer approaching than wait for the fall when we may have recurrence. So let me cover some of those things in detail. First of all, COVID can affect the eye, although it's very rare. When it affects the eye, it's a viral conjunctivitis similar to other viral conjunctivitises, and it's probably the least of all the patient's worries. Secondly, ophthalmology has had the greatest decrease in patient volume. We've decreased by 80%, and that's been due to a couple things. Number one, our patients are older, and we have to protect their safety. Number two, the American Academy of Ophthalmology told its members, its 20,000 members across the United States, to cease from seeing routine patients and doing elective cataract surgery back in the middle of March. Now, since then, we've seen emergent patients who need our care, and we've done emergency retinal surgery at the surgery centers, as well as glaucoma surgeries for patients to prevent them from going blind. Cataract surgery has decreased, as I said, by about 500,000 cases in the last 3 months. Typically in the United States, there's about 2 to 3 million cases done a year, and those patients still need their cataracts done. If there was a decision in February, March, or April to have your cataract surgery done, that decision still is appropriate today. Most of these patients are having trouble driving. They're having glare at night. It's dangerous. In fact, I've seen some of my patients who I haven't seen since February or March, and their vision is almost twice as bad. They're just begging to have it done. And fortunately, we've been open for cataract surgery to do it very safely for the past few weeks, and going forward, we're doing that as well. To talk about safety, the Hartford Hospital Eye Surgery Center in Newington, it's been around for 23 years. And let me tell you, historically, it is absolutely one of the safest places to have cataract surgery in the entire world. Thankfully, our administrators, our nurses, and doctors have stepped up to even a higher level to provide even more safety during these times of COVID. Let me tell you some of the things that we're doing in our offices and also in the surgery center in particular to safeguard all of our patients. Hartford Health Care has instituted a system-wide protocol where all the patients need to have a COVID negative test within 5 days of having their surgery, and they are supposed to self-isolate for those 5 days as well. To decrease the amount of paperwork going back and forth, we're having our patients register online through patient portals, or if that's too hard, they simply call the surgery center, so things are whisked as soon as they come in. When they're in the parking lot, they're told to call the front desk to make sure that everything's running exactly on time. We are decreasing the amount of surgeries right now so that we can be very timely for our patients. So once the patient is told to come in, they and all the doctors and nurses, every day we have a health screening done to make sure we don't have COVID signs, and we also get our temperature checked as well. So that's true of the patients also. Then they bypass the waiting room altogether. They go right back into the pre-op area. Everybody is wearing a mask. The patients, the nurses, the front desk. The doctors are wearing a double mask, including an N95. And there's certain protocols in the surgery that we go beyond and above and beyond what we used to do to prevent any aerosolization, which is very, very minimal. The last thing is that we also call our patients a week later to make sure they didn't come down with COVID, so we can do an appropriate tracing. And thus far, in my busy office, we have not had any spread of COVID to our staff at all. There's been one patient in all those times that did have COVID, and we took all the precautions, and the surgery center has had zero COVID of staff or patients as well. Now that it's coming to be the summer, it really is the best time to have your cataract surgery done. The curve is definitely flattening, as Dr. Kumar said. Things are going down, down, down all the time. My son's a medical intern, and he's telling me that the hospital is much safer as well these days, less and less COVID patients. So if you've been waiting to have your cataract surgery done, I encourage you to have it done because it's worse than it used to be. And furthermore, it's safe. The protocols are very safe, and things will get safer and safer as time goes on. And we hope and pray that there won't be a resurgence of it in the future. But if there is, come in now and get your surgery done. Thank you.
Thank you, Alan. Thank you, Amanda. At this time, I'll open for any questions or comments.
I can jump in if nobody has anybody. This is Tim Lammers from Fox 61. Good morning, everybody. I would like to ask a multi-part question to Amanda about the study.
Yep. Amanda.
If you could you get into a little bit more depth about the 38% reduction? Could you give that to me in terms of whole numbers? what the time frame was that you were looking at, exactly how many acute cardiac emergencies you didn't see? Was that across all of Hartford Healthcare? And if you could get even further than that, I'm also curious now that the country is starting to look at some indirect ways people are dying because of the pandemic, just from either lack of access to healthcare in other parts of the country or from people not seeking healthcare when they should have. Do you know maybe, is there a number, an estimate of how many people may have passed away from cardiac emergencies who otherwise would not have if they had come in?
Yeah.
That's a lot.
Yes. So to repeat the question in general, just a bit more detail about the study and the raw numbers. So again, this study is published in the American Journal of Cardiology. It is open access and available to everybody. What we did is we examined cardiac catheterization laboratory activations. So this means the folks that come in and meet the criteria for imaging or a little bit of intervention to see more of what's going on. So that could be either EKG, blood values, or chest pain. And what we did is we examined those activations. We took out anyone who had any planned or emergent planned events, right? And so we looked at those and we compared those to historical data. So we took the previous 4 years and averaged them for those months. It's important to match up months because we know that there is natural variation in cardiac presentation. For example, the winter, we know that it can be higher. And so we matched those to expected. And what we found was that there was a 50% reduction for the month of April and about a 25% reduction for the month of March. It's interesting if you look at the data on a granular level, and I didn't share this earlier, but we actually did see a slight uptick in February, indicative of perhaps a pre-pandemic, a sort of squall before the storm, if you will, suggesting that there might have been a psychological stress mediated, the stress of we know that it's coming and it's here and it's the United States might have caused an uptick. This is purely speculative, but we have seen this in other humanitarian emergencies of similar magnitude. In terms of raw numbers, I don't have those off the top of my head, but I'm happy to share the publication with you. And again, you can find it on the website. In terms of speculating exactly how many deaths, that's difficult to do. I know we're so sick of hearing this, but this really is the early stages of the pandemic. Our job as a scientist is to tell the story of the data, but we're not storytellers, right? And so I'm hesitant to speculate on who went where. Does that answer the question?
Yes, it does. I was just looking for more info, and you certainly provided. I appreciate it. Thank you.
Thank you. Are there any other questions do we have?
I could certainly ask another one if nobody has one.
Go for it.
Because I have not been on these calls on much, and I think this may be more for Dr. Kumar. I'm sure you've answered it 15 times over, but again, I don't get to listen in every day. Now that we're really starting to expand testing, have you guys broken down just how many of the tests you guys are doing are specific tests for current presence of the virus, like a PCR test, versus antibody tests, now that we're trying to get more people to see just how prevalent the virus was? Do you have those numbers?
Yeah, so thanks for asking this question. So just as a recap, there are two different types of tests: PCR to know exactly if anybody has a COVID-19, and antibody if somebody had COVID-19. We've done both testing in our system here. Antibody testing, this is a research project which is led by Dr. Pavlos Papasavas and Dr. Ulysses Wu at Hartford Healthcare. For antibody testing, we are testing our healthcare workers, we're testing our colleagues. We're dividing into the high risk and low risk areas, so the clinical and non-clinical individuals. We're looking at the prevalence at one given time, and we're going to repeat it again after a month or two to see the point prevalence at that time, to see the seroconversion, how many people convert with all the protection and all the things we're doing right now, what the change is. Our hypothesis is that we are in Hartford Healthcare, at least the sample size we're looking into, we're very well protected. Our colleagues are very well protected. Just to give you some rough estimates here, as of last week, we had 2,400 results back. We're testing at least 5,000. We aim to extend to 30,000 people across the system. 2,400 results were back, while 6% were positive. That means 6% of employees or healthcare workers had some point were exposed. Now, these are clinical and non-clinical. This is the two separate. So 6% is a really good number if you think about New York, which is a comparison where the numbers are about 14 to 15, some places 19%. So I think, so that's the antibody study to the prevalence study. Now, similar studies are going on, I believe, in other healthcare systems as well. Beaumont Health is doing a large-scale study. I know many other systems, Mayo Clinic is doing a similar study. So the protocols are similar to those institutions actually who are doing the similar study. So we're looking forward to seeing the national database would look like on that part here. That's about the antibody study. We have not yet done antibody study on the general population. That's something we're trying to understand the meaning of that in the healthcare system at the moment. Now moving to the PCR testing, Hartford Healthcare has done over 48,000 testing so far. That means about 40-something thousand individuals have been tested because sometimes we have to repeat the test twice. So about 48,000 testing we've done. We've seen a conversion rate anywhere from, depending on which month you're talking about, it's obviously going down right now as the testing is higher, the denominator goes up, anywhere from 11 to 14% out in the community. That's the drive-throughs, that's the patients who are coming in, and anybody else in the community. Now recently, we began doing the testing in our Department of Corrections and mobile testing sites and all that. We're still waiting to see what the numbers will look like at the moment. Now, that point prevalence, the PCR tells you who actually has COVID positive. It doesn't tell you who had COVID. So comparing the antibody and PCR value is not apples to apples. It's a separate, different questions we're trying to answer. I hope I answered all your questions, so maybe give you a little bit more than what you were asking for, but I'm happy to take any further questions on testing.
Thank you.
Any other questions from anybody?
I have a question.
Okay, carry on.
Yes, when it comes to the spread of COVID-19, you say that we are seeing these hospitalizations go down and people aren't really having to use ventilators, but we've seen a lot of protests this past weekend, these past few days. People are wearing masks for the most part, but obviously it's really hard to keep that social distance. So does Hartford Healthcare think that we might be seeing a bit of a spike in cases, or what's your take on that?
Yeah, would you mind introducing yourself from which channel?
Yes, I'm with Channel 3, Carolina Cruz.
Hi, Carol. So, the protests, as they're happening right now, I am encouraged to see a lot of people wearing masks as well. So I think that's a positive sign in that part here. But they are concerned, without a doubt, when the physical distancing is difficult to manage, especially in the crowd situation, especially when people are passionately talking about the issue and they're close together in proximity. We are concerned that we might see some impact on that, and time will tell. We'll wait to see what happens. I'm still hoping that, given the mask and other protections the individuals have, and I'm hoping that those individuals who are there are asymptomatic, they're not symptomatic at least. So there would be some amount of protection, but that's the wishful thinking right now. We could see some increase because of protest. We have to continue to keep an eye on that. And these are the things which are difficult to factor in the modeling we do, because it's difficult to predict the crowd size, the crowd proximity, the behavior, we're wearing masks or not. That's something difficult to predict. So these are one of those things we have to wait and watch. Tina, you have any questions on Facebook? Well, if there's no further question, I do want to thank my colleague, Dr. Amanda Zaleski and Dr. Alan Solinsky, who really gave wonderful information. I do want to recognize our teams here, our surgeons, and Dr. Solinsky, who ophthalmology and ENT surgeries are one of the two areas where there's a significant precaution needs to be taken. And I think the teams have done an amazing job of making sure that they're safely carrying out all the clinical work. And they've been working very closely with our infection prevention team, all divisions, all departments across the Hartford Healthcare. Infection prevention team is making sure there is appropriate measures in place, the social distancing in the waiting rooms, how the patients triage, how the process of accommodating patients in those areas. And I think that's a testament of the wonderful work our colleagues across the Hartford Healthcare are doing. So with that, I think we'll adjourn the conversation today, and we'll look forward to meeting tomorrow. Thank you.